day everyone, I am Gianna Cristal Agassi from BEd 1A. For today's video, we are going to discuss to you the body composition, body shape and health risks, techniques to assess body composition, metrics used to assess body size and shape, determining recommended body composition, and importance of regularly assessing body composition. So without further ado, let's get started. First, what is body composition? To understand the concept of body composition, we must recognize that the human body consists of fat and non-fat components. All the tissues that make up your body are called your body composition. Lean tissues includes muscles, bones, skin, and body organs. People who do regular physical activity have a larger percentage of lean body weight. The fat component is called fat mass or percent body fat. The non-fat component is termed lean body mass. Facts about body fatness. So, body fatness is a part of health-related physical fitness. Refers to the percentage of your total body that is comprised of fat tissues. It is important to have optimal amounts of body fat for better health and to avoid health risks. To determine recommended body weight, we need to find out what percent of total body weight is fat and what amount is lean tissue. In other words, assess body composition. But it should be assessed by a well-trained technician who understands the procedure being used to avoid health risks. So why does body composition matters? When studying large populations, simple height and weight measurements provide important feedback. By averaging data across large groups of individuals, scientists have been able to establish that the risk for premature illness and death is greater for those who are overweight and that the risk is also increased for individuals who are underweight. Most people kasi, kesyo payat ay okay na, kumakain naman ng healthy foods, kesyo ay malaman na ako, okay na to, may mga muscle naman ako, healthy na yon. People is relying on simple height and weight charts to determine their recommended body weight. Ngunit di nila alam na meron talagang way to measure or determine their body composition. Baka itong mga way nila ay mas lalo silang mapahamak. And sometimes, it can be highly inaccurate and can fail to identify critical fat values. So, the best way to determine whether people are truly overweight or falsely at recommended body weight is through assessment of body composition. Obesity. Obesity is an excess of body fat. If body weight is the only criterion, an individual might easily appear to be overweight according to height and weight charts, yet have a healthy amount of body fat. Typical examples are football players, bodybuilders, weightlifters, and other athletes with large muscle size. Some athletes who appear to be 20 or 30 pounds overweight really have little body fat. The importance of body composition was clearly demonstrated when a young woman who weighed 185 pounds applied to be a lady guard, but she got turned down. The reason? Because she was too fat. By getting her body composition, it was determined that only 5% of his total body weight was in the form of fat, considerably less than the recommended standard. Next, let's talk about the total fat in the human body that is classified into two types. That is essential fat and storage fat, to be discussed by Sheena.
Let's talk about the total fat in the human body that is classified into two types: essential fat and storage fat. Essential fat is needed for normal physiological function. Without it, human health and physical performance deteriorate. In short, essential fat is exactly essential for your life and for a healthy, functional body. It plays a significant role in overall health, and as its name implies, it is essential for survival. Essential fat is critical for your life. Without it, you would probably be weak or dead. Hence, it is not surprising that they are located in the most important tissues such as muscles, nerve cells, bone marrow, intestines, heart, liver, and lungs. Essential fat constitutes about 3% of the total weight in men and 12% in women. The percentage is higher in women because it includes sex-specific fat, such as that found in breast tissues, the uterus, and other sex-related fat deposits. Essential fat also plays a major role in hormone regulation, including hormones that control fertility, vitamin absorption, and temperature regulation. If you have essential fats in your body, then this means that you will be able to conduct all physiological functions such as absorbing oxygen and so forth. Hence, they are good type of fat, which means that you do not need to target them during weight loss. On the other hand, storage fat is found in your adipose tissue, mostly just beneath the skin, and around major organs in the body. This fat serves three basic functions. 1. As an insulator to retain body heat. 2. As energy substrate for metabolism. And 3. As padding against physical trauma to the body. The amount of storage fat does not differ between men and women, except that men tend to store fat around the waist and women around the hips and thighs. Storage fat is a type of fat that is not needed to perform vital functions in the body. This non-essential fat is stored under your skin and around organs if it is in excess. The main types of non-essential fats includes white, brown fat, beige or bright, subcutaneous, and visceral.
A pleasant day, everyone. The topic that I will be discussing to you is the body shape and health risks. As you have seen, body weight affects more than just physical appearance. Excessive body weight and lower health have been linked by research for decades. There is, however, another critical element at work. A person's total amount of body fat by itself is not the best predictor of increased risk for disease. It's not always mean that if a person has a lot of body fat in their body, then we can now predict that they are at risk for diseases. Yes, sometimes that's happened. However, the location of the fat is the best predictor of increased risk of diseases. Scientific evidence suggests that the way people store fat affects their risk for disease. Yes, and do you know that our body has 3 kinds of fats? The visceral, subcutaneous, and retroperitoneal fats. And I will discuss it to you later. So let's move on to our next topic. Body shapes. The body shapes are the 2 different kinds of body fat distribution. The first one is the android obesity. Android obesity is seen in individuals who tend to store fat in the trunk or abdominal area, which produces the apple shape. You can see there that the apple shape is on his trunk or abdominal area. Android obesity is male pattern fats because it is common in males. This happens to males' body majorly due to genetic factors and imbalance in the male body. This type of obesity causes cardiovascular diseases. The next one is the gynoid obesity. Gynoid obesity is seen in people who store fat primarily around the hips and thighs, which creates a pear shape. Gynoid obesity is female pattern fats because it is also common in females. Gynoid happens when a girl gets her puberty or when the body develops ovaries to support an infant. This type of obesity doesn't cause a high rate of heart-related diseases, but it impacts breast cancers in females. The health risks. Compared with people whose body fat is stored primarily in the hips and thighs, obese individuals with abdominal fat are at higher risk for heart disease, hypertension or high blood pressure, type 2 diabetes, stroke, some types of cancer, kidney disease, dementia, migraines, and diminished lung function. Obese individuals with abdominal fat is more on android obesity, and they are at higher risk for these diseases. So this is what I'm talking about earlier, that we have 3 kinds of fat in our body. The first one is the subcutaneous fat, or the SBC. You can see it in the figure where it is located. Sub means under and cutaneous means skin. At ito'y matatagpuan sa ilalim ng ating balat. If we have subcutaneous fats in our belly, we can touch it. And if it's fluffy and pwede itong kurutin, then this is a subcutaneous fat. Then next one is the VSC, or the visceral fat. From the word viscera means internal organs. Ang fats na ito ay nakabalot sa ating internal organs, tulad ng intestines, liver, spleen, and even the heart. If we have more visceral fats in our abdomen, we have to test it in our belly. Kung ito'y mahirap kurutin, kasi mas malalim ito kaysa sa subcutaneous fats. The last kind of fat in our body is the RTP, or the retroperitoneal fat. RTP is located on the back of the abdomen, behind the peritoneum. The peritoneum is the tissue that lines the abdominal wall and covers most of the organs in the abdomen. You can easily see it in the figure where it is located. Where is SBC located? VSC located, and RTP. It is easy to distinguish their differences, and the yellow parts in the figure are the fats stored in our body. And seeing the locations of the fats will make us understand if we are in higher risk, in lower risk, moderate risk, and highest risk. I hope you got information about the topic I discussed.
Good morning to each and every one of us today. I am Katrina Lay Abelia and I was designated to explain this part of our PPT, the techniques to assess body composition. So first technique is the Dual Energy X-ray Absorptiometry or DEXA. What do we mean by this? It is a method to assess body composition that is used most frequently in research and biomedical facilities. Or it is the energy X-ray absorption that used to measure bone mineral density using spectral imaging. DXA uses very low dose beams of X-ray energy, or hundreds of times lower than a typical body X-ray, to measure total body fat mass, fat distribution pattern, and bone density. DXA is used as a standard of comparison for all other body composition tests due to costs. However, DXA is not readily available to most fitness participants. The DEXA scan is an X-ray scan that uses a small amount of radiation to take pictures of different bones. These pictures are used to measure the density of the bones at the spine, hip, and forearm, and also muscle mass. DEXA help to work out your risk of breaking a bone. They're often used to help diagnose bone-related health problems such as osteoporosis or to assess the risk of getting them. DEXA testing is the most accurate method available for the diagnosis of osteoporosis and also considered an accurate estimator of fracture risk. DEXA equipment is widely available, making bone densitometry testing convenient. No radiation remains in a patient's body after an X-ray examination. And as a easy understanding of this method of repairing and healing is a good and a big help for us nowadays, because as we are engaging ourselves more on playing gadgets, as we are on modernized era, we are no longer doing workouts to strengthen our bone density and muscle mass, but with the help of DEXA X-ray, it can find out what are the things you should do to improve your bones. But as I have said a while ago, take note that DEXA is not readily available to most fitness participants. Second technique is the hydrostatic weighing. Until the advent of DXA, hydrostatic weighing had been the most common technique used in determining body composition in exercise physiology laboratories. With hydrostatic weighing, a person's regular weight is compared with the weight taken underwater because fat is more buoyant than lean tissue. Comparing the two weights can determine a person's percentage of fat. In this method, it requires a considerable amount of time, skill, space, and equipment, and must be administered by a well-trained technician. Moreover, this technique has several drawbacks. First, because each individual assessment can take as long as 30 minutes. Hydrostatic weighing is not feasible when testing a lot of people. Furthermore, the person's residual lung volume or amount of air left in the lungs following complete forceful exhalation should be measured before testing. If residual volume cannot be measured, as is the case in some laboratories and health or fitness centers, it is estimated using the predicting equations, which may decrease the accuracy of hydrostatic weighing. Meaning, sa madaling salita, sa pagkukuha ng resulta, before you hold your breath into the water for long exhalation, you must get your pre-assessment record of breathing para maitala ang record ng iyong breath volume ng iyong lung capacity para malaman at makakuha ng magandang resulta. There is also procedure in taking underwater weighing trial. The number one is that the person has to force out all of the air into the lungs. Second, lean forward and completely submerge underwater for about 5 to 10 seconds. Lastly, remain as calm as possible. This procedure is repeated 8 to 10 minutes. To add up for accurate results, the individual must be able to test properly because it is significant to obtain an accurate reading. The third method is the air displacement. When using air displacement, or also known as air displacement plethysmography, is an individual sits inside a small chamber, commercially known as the BADPAD. Computerized pressure sensors determine the amount of air displaced by the person inside the chamber. The procedure to assess body composition according to air displacement takes only about 15 minutes. Initial research showed that this technique compared favorably with hydrostatic weighing while being less cumbersome to administer. Subsequent research determined that percent body fat is about 5 percentage points higher with air displacement than with hydrostatic weighing. Researchers have concluded that further technical work is required to make air displacement an acceptable technique to determine body composition. Moreover, research is required to determine its accuracy among different age groups, ethnic backgrounds, and athletic populations.
The third technique to assess body composition is the skin fold thickness. Primarily, skin fold thickness and girth measurements allow quick, simple, and inexpensive estimates of body composition. Assessing body composition using skin fold thickness is based on the principle that the amount of subcutaneous fat is proportional to total body fat. This means that measurement is a reliable, inexpensive, simple, and non-invasive way of estimating body fat in people of all ages, including newborns. It determines the thickness of fat tissue at various body sites, allowing total body fat and thus fat contribution to body mass to be calculated. A skin fold test is done with the aid of pressure calipers. All measurements should be taken on the right side of the body. The fourth is the girth measurements. This technique requires only a standard measuring tape. The limitation is that it may not be valid for athletic individuals, men or women, who participate actively in strenuous physical activity, or for people who can be classified visually as thin or obese. Measurements for women are the upper arm, hip, and wrist. For men, the waist and wrist. This is the best measured with a tape measure to obtain the circumference of the girth. This is a method to know the changes in body dimension over time. It measures around the body. As what I've said a while ago, the measurements for women are the upper arm, hip, and wrist, and for men are the waist and wrist. Lastly is the bioelectrical impedance. In this technique, sensors are applied to the skin and awake, totally painless. Electrical current is run through the body to measure its electrical resistance, which is then used to estimate body fat, lean body mass, and body water. This bioelectrical impedance is a method for estimating body composition, in particular body fat and muscle mass. Sensors are applied to skin and a wick. Electrical current flows through the body. The easier the conductance is, the leaner the individual.
Next is metric used to assess our body size and shape. There are two ways or metrics used to assess our body size and shape. First, the most basic method and the most common is the body mass index, or we call it the BMI. Doctors can easily calculate BMI from the heights and weights they gather at each checkup. BMI tables and online calculators also make it easy for individuals to determine their own BMIs. BMI is a good way to gauge whether our weight is in healthy proportion to our height. Second is waist circumference. It's easy to measure your waist. It's not just about your clothing size. Your waist circumference is a clue whether you are at higher risk for type 2 diabetes, high blood pressure, high cholesterol, and heart disease. And all you need is a tape measure. And we go now on how BMI is calculated. BMI is calculated the same way for both adults and children. We use kilograms and meters or centimeters in measurement units. And for the formula and calculation, with the metric system, the formula for BMI is weight in kilograms divided by height in meters squared, because height is commonly measured in centimeters, and divide height in centimeters by 100 to obtain height in meters. And I know all of us knows how to get our own BMI. How is BMI interpreted for adults? For adults 20 years old and older, BMI is interpreted using standard weight status categories. These categories are the same for men and women of all body types and ages. And here are the classification of BMI. If your BMI is below 18.5, you are underweight. And 18.5 to 24.9 is a normal or healthy weight. 25.0 to 29.9 is overweight, and 30.0 and above is obese. The higher your BMI, the higher your risk certain diseases. And how to measure your waist circumference. And there are 3 steps to measure our waist circumference. First, stand up straight and exhale. Second, wrap a tape measure just above your hip bones. Third, hold the tape measure and flat against the body, not too tight, and take a reading.
Determining recommended body weight. Step 1. Know the recommended or the average fat percentage ranges. Step 2. Weigh yourself. Obtain as accurate a body weight as possible. Different scales often give different numbers, and depending on the time of the day you weigh yourself, your numbers may vary. Step 3. Calculate your body mass index or the BMI. Body mass index is a simple calculation using a person's height and weight. The formula of BMI is equal to kilogram over m square, where kilogram is a person's weight in kilograms and m square is their height in meters squared. Step 4. Calculate your body fat percentage. And Step 5. Compare your body fat percentage to the percentiles listed in Step 1.
We will talk about the importance of regularly assessing body composition.
Why is body composition important to measure? Regardless of your health goals and fitness level, it's wise to keep closer eyes on your body composition over time. Here's why it is important to get body composition check-ups regularly scheduled intervals. Assessing body composition can help you find that healthier body composition is less fat and more muscle mass. Too much body fat can lead to risks like cancer, diabetics, heart disease, and other health problems. You can measure your progress, while a single body composition analysis will give you a solid understanding of where you were starting. Monitoring your body composition over time will reveal your progress. By tracking changes in fat and lean mass, you can assess what is working with your current fitness and our nutritional strategy and make tweaks accordingly.
Keeping an eye on your body composition lets you spot unwanted changes, such as unnecessary fat gain, muscle loss, or bone density loss. Through routine body composition checkups, you can catch these negative developments while they are minor. This allows you to make changes to your lifestyle before small, unwanted changes balloon into much larger problems like chronic illnesses. You can set attainable time-bound goals. After embarking on a new fitness and nutrition plan, measuring your body composition will give you a sense of the time it takes for your body to make the changes you want. Armed with information, you'll be able to set attainable health and weight optimization goals within an appropriate time frame. The importance of monitoring our body composition over time. By tracking our body composition, we can measure our progress, catch unwanted changes, and set attainable time-bound goals. BMI is calculated by dividing our weight by our height squared, limited metric with critical flaws, while perhaps is slightly more useful than looking at scale weight. BMI does not distinguish between excess fat, muscle, or bone mass, nor does it provide any indication of the distribution of fat within the body. When it comes to assessing the impact of your fitness, nutritional, or lifestyle changes, there are other more valuable indicators of progress, first and foremost of which is our body composition. Body composition has been embraced in the last few decades by medical science as one of our most effective measures of body fat and overall health. Defined simply, our body composition is the total amount of fat, muscle, bone, and water in our body. Body composition analysis goes beyond our weight and the traditional body mass index to reveal our body's proportions of fat mass and lean mass. Fat mass refers to all the different parts in our body, while lean mass refers to our muscles, bones, ligaments, tendons, internal organs, essentially everything in our body that isn't fat. We hope you learned something from our presentation. Thank you for listening.